Hi, my name is Preston Satoris. I am a current fourth year medical student, and today I'm going to be presenting nightmares versus sleep terrors or night terrors. This is going to be part of our video library series where we're providing hopefully a good set of resources for daycare providers and personnel to help support young children with social, emotional, or behavioral issues. So let's get started. First of all, many thanks to Julia Wong, who designed this original lecture, and it has now been edited with permission for the specific focus of this project. So, thank you, Julia. So we'll begin by kind of listing the learning objectives pretty quickly. First of all, very simply, we want to define nightmares versus night terrors. They sound very similar, but there are important distinctions to make between them. In order to help us understand them, we also need to understand at least the basics of EEG sleep patterns. In addition to that, we're going to understand the association of sleep disordered breathing and night terrors. We're also going to recognize safety and behavioral interventions for night terrors. And we're going to learn the limited role of medication in treatment of night terrors. So with these issues, usually we want to treat conservatively, but there is a role for medication if conservative treatment fails. So let's get started. So what are nightmares and night terrors? Okay, we'll get to the start of it. They're basically types of parasomnias. So parasomnias are disruptive sleep-related disorders that can occur during arousals from REM sleep or partial arousals from non-REM sleep. So don't get too intimidated by REM sleep, non-REM sleep. We're going to talk about those a little bit later. But what you need to know is it can affect actually up to 50% of children. So it's not unusual to have nightmares or night terrors. And examples of these include nightmares, night terrors, sleepwalking, sleep talking, confusional arousals. All these are disruptive sleep disorders, and so they kind of fall under the umbrella of parasomnias. So a nightmare is basically a scary dream in the middle of the night or early morning that a person can remember when they wake up. This is usually what we think of when we think of waking up in the middle of the night and we remember monsters or being chased or whatever. These are usually nightmares. So this is actually an REM sleep disorder, and kids may not be able to go back to sleep because they remember their nightmare. They're afraid to go back to that world. And again, very common. Most kids will at some point have nightmares occasionally. Night terrors, on the other hand, are scary dreams at night that prompt screaming or crying when the person awakes. However, an important distinction is they cannot remember the dream. Part of this is because it's an NREM sleep disorder. Again, we're going to talk a little bit more about that later. And after a few moments, the child most often relaxes and they go right back to sleep. And they're a little bit more rare than nightmares. So, now that we've kind of gone over the basics, let's lay them side by side to really understand the differences. So again, nightmare, scary dream awakens child, occurs in the last hours of the night. Child cries and is afraid. Child is aware of the caregiver, especially if you're in the room. They'll be able to recognize you, understand that they're out of the dream and they're with you. But the child may have trouble going back to sleep. And often they'll remember it and they may want to talk about it. So, being there for them is very important in that case. Whereas night terrors, they actually only awake partially. If they awake at all, sometimes they won't. Occurs 1 to 4 hours after the child falls asleep. So again, nightmares occurs in the last hours of the night. Night terrors can occur usually in the middle. Child will sit up, thrash, and struggle with the caregiver, and it may scream, cry, or talk aloud. Eyes staring ahead, heart racing, so almost like panicky, right? And in this case, child is not aware of the caregiver. Remember, they're only partially awake, so they're not really understanding that the dream is over, the nightmare is over, night terror, whatever. They're still kind of in that zone, okay? And oftentimes the child will go back to sleep without even awakening. Child won't even remember the dream or waking up screaming or thrashing. So if you mention it to them, like, they might be weirded out. They might not understand because they don't remember. As far as prevalence goes, nightmares are more common, 10 to 50% in 3 to 5 years old. Onset's usually between 3 and 6, and it peaks at 6 to 10 years old. And again, occurs more towards the end of your sleep. Night terrors, on the other hand, are a little less common. 1 to 6.5% in children, 2.2% in adults, and it usually begins in early childhood. And there's actually some considerable overlaps with other parasomnias. Again, remember, talk about sleepwalking, sleep talking. Those are other examples. And again, usually occurs in the beginning of the sleep period. So, here you go. So EEG sleep patterns, we touched a little bit on this, but the basics are sleep is divided into two broad types, okay, two big subsections. There's NREM sleep, which stands for non-rapid eye movement, and REM sleep, which is rapid eye movement. So you don't have to super memorize all these different waves to really understand nightmares versus night terrors, but this is here if you guys want to look at it. But really what you need to understand is that the majority of sleep is actually NREM, and it's divided into 4 stages: stage 1, stage 2, stage 3, there is a stage 4, and then after that you go into REM sleep. They actually cycle back and forth, each lasting about 9 to 100 minutes, total of 4 or 5 cycles. And let me see. Okay, so non-REM versus REM sleep. What is this? Okay, so non-REM actually has a slow EEG. You might have muscular activity, and dreaming is rare. This makes up most of your sleep time. It's 80%. REM sleep, on the other hand, again, rapid eye movement. It's similar to an awake person. It's like your brain is awake, and that's why dreaming is common. You're able to remember. It's almost as if you're like awake right now, right? However, you don't have any movement here. It's total motor paralysis, and it's usually pretty hard to awake you at this point. Pretty deep sleep. In terms of night terrors, we can look at these using EEGs. Typically, it's a spontaneous attack during stage 3 of NREM sleep, and there's 2 seconds of what we call hypersynchronous high voltage delta wave arousal. Okay, this brief EEG delta discharge is usually immediately precedes the clinical episode, and you can also see something we call an EKG to track the heart rate. You can see it's an increased heart rate. Again, panicky, specifically night terrors, according to the National Sleep Foundation, about 38% of all children will experience a period in which sleep terrors occur. Night terrors are pretty common in children, even though they're less common than nightmares, occurring about 5% of them, mostly between the ages of 3 to 5 years old. So we're getting them, or the kids are getting them. What causes them? Most of it is stress. So examples of things that can cause stress include schoolwork. For many kids, school can be overwhelming. It's hard to keep up with classes or understanding lessons or homework. This can cause a lot of stress for the child. And so sometimes being able to talk with them about this, or making sure they're able to keep up with classes, making sure they're understanding it's okay to not be able to understand right away, helping them with their homework. These can all help with decreasing the amount of nightmares and night terrors. Pressure from sports, sometimes they'll feel bad when they're not playing well enough, and just sports in general can cause a lot of stress for the child just doing it, right? And so that's something you'd want to look out for as well. Being sick, fevers and other ailments can definitely cause nightmares. Your body feels bad, so your mind feels bad, and so you start getting nightmares and other parasomnias. So some medications to treat these sicknesses can also cause nightmares as well. So you want to be careful or be aware of what the child is taking, and maybe see if there's a correlation between them taking the medication and them starting to have these parasomnias. Major changes can cause a lot of stress. Or going from your childhood home to a whole new environment where a child has to make friends and continue growing up in unfamiliar surroundings. It can be a little bit overwhelming, and so this can definitely cause a bit of stress and cause some parasomnias. In addition to that, the death of a loved one. This is a major change, especially for a young kid who doesn't maybe have that much experience with death. Finding out that a loved one has passed can definitely prompt the child to feel depressed without the loved one, as well as face the fear of death itself. So again, when things like moving or the death of a loved one happen, it's very helpful to talk to the child about these changes, and help them work through it, because these are whole new experiences for them. This is kind of obvious, I would think. Scary books or movies. Terrifying images or concepts newly introduced to the child can trigger their imagination to conjure similar horrific images in their dreams at night. There's also a popular trend right now with YouTubers playing horror video games. And so, even though the YouTubers are making jokes and stuff, some of these games can be pretty scary. And so that's something to be aware of if your child's having nightmares. They're also watching these kinds of scary media. Okay. There's also been research about sleep disordered breathing causing nightmares. So, some sleep fragmentation, which is basically disrupted sleep throughout the night, has been shown to be due to sleep disordered breathing, at least sometimes, which can increase in slow wave sleep as a recovery mechanism. Possible increased risk factors for night terrors because they occur in stage 3 or 4 of sleep, so that correlation is kind of indicating that it does play a role in night terrors. There's also maybe some genetic causes of night terrors. One study found that 35% of children with both night terror and sleep disordered breathing, for example, obstructive sleep apnea, have at least one immediate relative or intermediate relative with a parasomnia. 51 of 84 children had both night terrors and additional sleep disordered breathing. They found that with these sleep disordered breathing, if it was treated, the night terror symptoms would actually disappear. So again, a lot of evidence that shows that they might be linked. And then finally, there are just multiple other reasons too. For example, maybe the child isn't eating well, or maybe they're eating a new food, too much caffeine, generally just not getting enough sleep, right? Kids like to stay up maybe a little bit longer than they should. So good sleep hygiene can definitely help. So we've kind of talked about difference between nightmares and night terrors, why it can happen, and so now we want to get to you as a provider or daycare personnel or something with this kid. You want to help them, right? So what can you do? Healthier sleep routine. We just touched on it. Sleep hygiene is incredibly important. You want to make sure the kids have been sleeping well at home at an appropriate time and waking up at the same time every day. As they get older, you want to try to avoid naps. That can kind of disrupt their pattern of sleeping, and so again, that can lead to nightmares and night terrors. Make sure they avoid other bad sleep hygiene, including eating right before going to sleep or exercising right before bedtime. Or this is obviously a big one. I'm sure everyone's seen this, using a phone in bed. I'm guilty of it. I'm sure kids are into it nowadays too, and so that's something you want to look out for. And making sure that they have a safe environment. This is another important thing that you can do. You want to avoid bunk beds. Maybe try safety gates. You want to remove sleep disturbances such as certain sounds. Those are things that you can do to kind of make sure that they have the safest, most comfortable sleeping environment that they could. So, also, stuffed toys or favorite blankets, this may not be a surprise. We've always seen kids, or maybe as a kid you had a teddy bear that you really liked. These can provide a sort of comfort for the child. And so something like that can really help them to relax when they're asleep. And then night lights. Whether it's nighttime or maybe they're having an afternoon nap in a dim room, make sure there are some sources of light. When rooms are too dark, it's easy for kids to imagine really scary figures. They have pretty bright imaginations. And so something as simple as having a nightlight can really help. In addition to that, if they wake up from a nightmare, it'll be easier for them to calm down when they reorient themselves with familiar things that they can identify, right? They can see their room, they can see maybe you or something familiar, so they can kind of make sure, come back to like, okay, I'm good, I'm safe, I'm not in the nightmare anymore, I can relax, okay? In addition to that, ambient noise and music. When you sing a lullaby, or maybe you have like an ambient rain playing on an Alexa or Google Home or whatever, these things can help soothe the child to sleep. And finally, just making sure they know that you're there for them. If they have a nap time, maybe make it so that you're in the room with them. If it's not possible, then keep your door open so they can see you even if you're in another room. Be able to reassure them if they come to you. Again, kids have pretty vivid imaginations. So the magical powers of your love and protection can work wonders. For the most part, we want to treat conservatively. Make sure that you understand that their nightmares and night terrors usually end on their own. But if they don't go away, kids may need to visit a doctor or a psychologist to see if there's something else behind the bad dreams, whether it's physical or mental. In addition, medical professionals also have various therapies and treatments that may assuage these dreams. Things like waking treatment. So, night terrors usually occur around the same time at night. If you track the timing of the night terrors for a few nights, and then fully awake the child 15 to 30 minutes before the night terror occurs, and then allow them to sleep again after 5 minutes, this actually has been shown over time to help them get rid of those night terrors. You usually want to just do it for 1 week and then you stop waking. If the terrors return, you want to repeat the waking for 1 more week. And studies have found that this kind of behavioral intervention is 90% effective in a study of 50 children. In addition to that, hypnosis. It's a little out there, but it's been shown to work in adults. Mild night terrors, self-hypnosis, things like deep breathing, concentrating on relaxing imagery, and then for severe night terrors, professional hypnotism, suggestions to reduce awareness of nocturnal sensory stimuli. These are things that you might not think would work, but they have been shown to. And then finally, there's just straight medication. Tricyclic antidepressants, also known as TCAs. Examples of these are imipramine, trazodone. They're used often as a temporary treatment in conjunction with hypnosis. You can also try benzodiazepines, for example, diazepam. They suppress slow wave sleep and have some disadvantages. They can be addictive. There is growth hormone secreted in slow wave sleep, so if you suppress it, it can cause issues with that. And some studies show that it doesn't even work. So, it's still up in the air. Again, with all these medications, you don't want to just go and get these yourselves. You always want to do this with a consultation of a doctor. Then melatonin therapy. I'm sure everyone's heard of melatonin in the past. It's a neurohormone produced by the pineal gland. And you don't really need to know too much about what that is, but basically it's a substance produced by our bodies to help us sleep. And so it can be a therapy for sleep phase onset delay. You're not able to sleep right away, and so this can help. In cases where it's been prescribed, they take a controlled release 30 minutes before bedtime, and studies have shown that it can make parasomnias disappear, like in this 12-year-old boy, within 2 days. So it works pretty quickly. And that's going to be the end of my presentation. I hope it helped to elucidate some of the confusion between nightmares and night terrors and why it happens, and then what you as a provider can do about it. If I thank you for your time, and I hope this helped. And then here are the references. Thank you.